Hello and welcome to a special episode of the Power Panel. Before we dive into our exciting topic, I wanted to mention that today's Power Panel is brought to you by MYOS MD, the cutting-edge nutritional supplement designed to combat muscle loss and support healthier aging. Powered by Fortetropin, a natural bioactive compound clinically shown to enhance muscle growth and reduce anabolic resistance, MYOS MD is changing the way we think about muscle health. If you'd like to learn more about MYOS MD or Fortetropin, you can visit myosmd.com. All right, so let's dive into today's topic. We have our first recurring guest, Dr. Chris Meletis. So I think the viewers probably know a little bit about you already, but can you give everyone a little bit of background to set the stage for what we're going to talk about today?
Certainly. And thank you, Dr. Swathi. I've been a naturopathic physician for 33 years. I've written a couple hundred national articles, 19 books, and I love learning science. And I stay humbled every single day of my life. The more I read the peer-reviewed literature, I'm going like, darn, I didn't know that. So I think we're just going to share some passion, some things I've learned over the years. And I think that our whole audience knows things I don't know and vice versa. So let's all learn together.
Amazing. So today we are diving into cholesterol, a little bit of the good, the bad, the ugly, and the amazing, and everything that we need to know about it. So let's start with the basics. So what role does cholesterol play in the body, and why should we think beyond it being good versus bad? Because oftentimes that's the narrative as, we as clinicians are talking about. It's either good cholesterol, bad cholesterol, or having too much of it or too little. So would love to hear your perspective on this.
Well, in short, no cholesterol, no us. Every cell membrane, we need cholesterol. The quantity of cholesterol in our cell membranes determines how healthy our cells are. And we would not be able to reproduce as human beings because cholesterol is a building block for pregnenolone, DHEA, progesterone, testosterone, estrogen, and also we couldn't be stressed out. And aren't there a lot of things to be stressed out about today? Yes, but we couldn't even make cortisol. So cholesterol is a building block. Plus, now that the summer is here and we're outside, we couldn't make vitamin D because once again, cholesterol is critical for vitamin D production and all the milieu of benefits of vitamin D. So cholesterol is foundational, and we kind of vilify things. We kind of, as a society, are either on to something or off on something, but cholesterol is essential to life. In fact, interesting, 80% of our cholesterol is not consumed. It's made by our body. That's how important it is. And that's kind of my excitement. It's like, wow, anything endogenous made in our human body, we should be excited about because it's there for a purpose. And therefore, we need to pay some homage to it.
Yes, definitely. And in the context of aging and muscle loss, why is it important to ensure that, we have muscle supportive interventions like Fortetropin? And how can we ensure that some of these interventions don't negatively affect our lipid profiles?
Well, certainly. I think we've all been vilifying eggs, for example, and high-fat foods. Now, we know trans fats are bad. We know fried foods are bad. We know certain seed oils like canola oil are not good for us, omega-6s. But when it comes to saturated fat, all of humanity has always consumed some degree of saturated fat. And so you need that, of course, for our DHEA and our testosterone. And men and women both like to have DHEA and testosterone, which are anabolic. But as we age, our hormone levels become more diminutive. And so therefore our anabolicness, our muscle building, of course, diminishes. And our catabolic effects increase with stress. And that's why I tell anybody wanting to work out and become fit, don't watch the news. Because if you watch the news, your cortisol levels are going to rise. And that's a catabolic hormone. And so we want to avoid those. And you as a PharmD know that prednisone and methylprednisolone and all those are things that are going to tear you down, or if you rub it on your skin too much, it's going to thin your skin. So we need to control our cortisol levels, but we need to support our anabolic. So as I'm getting older, of course, I'm not making the testosterone I used to. And of course, when women hit menopause, they're not making the DHEA, but particularly the testosterone they used to. But as we get older, sarcopenia happens. Sarcopenia is, of course, the aspect of losing muscle mass. And so when we lose muscle mass, our morbidity and our mortality increases. So we looked at 10 people and they had different levels of muscle. Those with the higher muscle, all things being equal, would have less morbidity and mortality, whether it be diabetes, heart disease, onwards and onwards. let alone a big concern with my patients over the last 33 years, is fall risk. As they get older, they don't want to go outside because they're going to fall. But it's like, if we don't use it, we lose it. So, and sadly, and we both know this, our myostatin levels rise with obesity, and our myostatin levels rise with age. And myostatin inhibits muscle production. So we want to control. And that's where Fortetropin comes in. It's been shown to help reduce myostatin, help with anabolic resistance, and also increase protein synthesis by 18%. And per Dr. Evans' study, it's like, wow. So it's going to increase muscle potential, 18%. It's going to reduce the myostatin, which is acting basically as a roadblock. So it's like, let's level the playing field. And that's what Fortetropin does. I would say it's a level the playing field kind of substance, and all natural.
Great. So what would you say to someone who is hesitant? So someone isn't, sorry, let me back up. What would you say to, a healthcare provider who is perhaps interested in incorporating Fortetropin for, their patients, but they're worried that it could actually negatively impact the serum lipids or cholesterol? So from a clinician's perspective, how would you respond to that?
We consume cholesterol. Once again, that's where I have it. I wrote a paper called the 80-20 perspective, which is available on the MYOS website. And once again, 20% is consumed, 80% is made by the body. So unless we're just going, crazy on our cholesterol levels, then we really don't need to worry about it. But if a person is really concerned, you know what the lipids are, well, then they remeasure the lipid panel. And in my 80-20 perspective paper, I also said, let's not get stuck on the 1950s lipid panel of total cholesterol, HDL, LDL, and triglycerides. There's so much more. There's SDMA, ADMA, myeloperoxidase, the lipoprotein A, apolipoprotein B, homocysteine, fibrinogen. There's all these other risk factors. And we've kind of reduced ourselves reductionistically to old thinking. And so, for example, quote unquote, the bad cholesterol LDL. Well, is that oxidized LDL or non-oxidized LDL? If you're eating your fruits and vegetables and you're having a cholesterol substance, well, then you're not going to oxidize. It's not going to be as sticky and as gooey. Or, once again, if you're more stressed, that's going to alter your lipid profile as well. So there's just so many considerations. And so we need to really move towards that. But if a person's concerned, back to your exact question, remeasure them. See if they, for some reason, the levels have skyrocketed. Per the Tampa study, which I know we planned on talking about probably today, the Tampa study actually looked at healthy guys, 45 of them, 18 to 21, and they looked at, hey, did their lipid profile change with triple the normal dose of Fortetropin? And the answer is no, it did not. So it's like, wow. But, here's these guys. They're basically could with triple the dose and no negative effect. And so, once again, individual results will vary always. You and I both as clinicians know that. So remeasure them. If someone's concerned, remeasure them, see what they're doing. But look for that bigger panel. Look for that Cleveland Clinic or the Quest Diagnostics panel, which incorporates Cleveland Clinic, or the Boston Heart Lab. Go big and actually get the full picture, opposed to, well, your numbers are just the 5 indices. They're good. But once again, 50% of people, per Dr. Stephen Sinatra, world famous integrative cardiologist, MD, he said, hey, half the people with good cholesterol still die of heart disease. Half the people with high cholesterol won't die of heart disease. And he called it the cholesterol myth. So cholesterol is still an indice. We want to measure it. We're not throwing baby out with the bathwater, but it's just one of many considerations.
Definitely. So you mentioned the Tampa study that had the young, healthy male adults. So what other clinical populations do you believe that can stand to benefit from muscle-focused interventions like Fortetropin that don't negatively affect lipid panels?
I think everyone, unless you have an egg allergy. If you have an egg allergy, do not take Fortetropin. It's made from egg yolk, okay? But other than that, everybody can benefit. In fact, there's even some mechanisms of action which have not been explored for Fortetropin, but for the myostatin inhibition or reduction, because it's not a drug, so it's not inhibiting, it's reducing, and even maybe for osteoporosis, maybe for other factors. So this rising myostatin with age and obesity and all these other woes of the world are all robbing us our structural integrity. And I have a saying, structure begets function and function begets structure. And so we actually have to support the body. So I use it in my clinical practice for osteoporosis. I actually had a gentleman that was 86 years old. He took a tumble. He broke the head of his femur off. And this is a guy that did 10,000 steps a day in his 80s. In fact, he also made it a point in his 2-story house to walk 50 flights of stairs a day. But then he fell. So he's great shape. He was lean, but then he had trouble walking a straight line. He was starting to lisp. And, he just wasn't rehabilitated. We put him on Fortetropin. My osteoporosis patients, I put him on Fortetropin. Not only for muscle mass and integrity, because the greater our muscle mass, the more weight we're bearing. And we know weight-bearing exercise is one of the prescriptions for osteoporosis. So all of a sudden, as we're losing all this weight in today's society with GLP-1s and all the other renditions now, it's like, no, we got to support the muscle. And the muscle creates, as you and I both know, myokines and exerkines, which have hormonal effects throughout the entirety of our body. You think we're working for our muscles, but our muscles should be working for us too. So it's a yin-yang homeostasis.
Yes, definitely. And so you mentioned, that Fortetropin is derived from fertilized raw egg yolks. So what do you say to clinicians who are hesitant about, should I be eating eggs? Should I just be taking Fortetropin? Like, what is the real difference from a safety and absorption perspective? And why should we be recommending Fortetropin over eggs or the other way around?
Yeah. So should we drink raw eggs, Rocky Balboa style, out of a blender and well, first off, Fortetropin is from fertilized eggs. So what we get in the store is not fertilized eggs. So that's the big difference. We know from the Northwestern University study, when they looked at human egg and sperm, the moment that sperm enters the ovum, the oocyte, there's a spark of life. There's a transition that occurs. So we go from 1 to 2 to 4 to 8. We know the embryology. So once again, something starts changing when something becomes fertilized. Life sparks forward. And so I think as a result, that's the big difference. There's something unique about the fertilized. And because it is processed and safe, what I tell people, just go to a local farmer's market, find some roosters and chickens that are cohabitating and grab their eggs after they've been fertilized. Yeah, we got salmonella, we got those kind of things. But with Fortetropin, we don't have to worry about that.
Yes, I agree. So I want to also hit on another question that we've received many times over from clinicians. So what about the patients that are on statins? What about, maybe they're not on statins, maybe they're on other cholesterol lowering medications or even cholesterol lowering supplements? Those are very common in the aging population. So what consideration should healthcare providers have about combining those therapies with, muscle supportive interventions like Fortetropin?
Yeah. So because of the cholesterol side of things, again, obviously always refer to your cardiologist, always refer to your primary care prescribing doctor. But when I have a patient on a statin drug, and as a naturopathic physician, I have a DEA number I can write for virtually every drug except for class 1s out there. And it's like, would I tell them to stop eating all animal products? Would I tell them to stop eating fish? Would I tell them no, eat red meat? Don't eat baked goods with eggs? And of course not. I'm going to, of course, tell them moderation is the key. And the small amount that is needed for the benefits per the peer-reviewed literature for Fortetropin and the Tampa study, it doesn't remove the needle. But once again, what you and I do as clinicians, we do serial testing. We'll say, okay, great. Betty Jo started on the Fortetropin and her cholesterol is the same. And 6 months later, then great. If not, we adjust things. But the other big thing with the statin drugs, and I mentioned other drugs, of course, there's the binders and all the other cholesterol drugs. But we know that from HMG-CoA, we, of course, go either down to mevalonic acid or CoQ10. So one of the big issues is when we start blocking the HMG-CoA, the statin drug category, we're going to be blocking CoQ10, and CoQ10 is critical for the mitochondria. And so what do we need for muscle performance? We need CoQ10. So people that are on statin drugs, unless there's a contraindication, I always tell them go on a CoQ10 product. And red yeast rice, the great grandmother of the statin drugs, of course, once again, the same thing, CoQ10. So I think the key is support the mitochondria, support the muscle, and support the whole person, and not just focus totally on lipid panel. We're going to track the lipid panel, but what I've found in my clinical practice is does not change. Just like the Tampa study, it does not change.
Right. And beyond lipid safety, Fortetropin has been shown to, lower myostatin levels and support muscle protein synthesis, even upwards of 18% in, older adults who are not exercising. So just as we talked about before, the Evans study. So how does this dual action fit into a broader metabolic strategy, particularly for patients who are in the aging realm?
I kind of look at it as a fortifying or, you know, I hate to use a word, scotch guarding or waterproofing ourselves. There's certain things that happen with aging. It's inevitable. Ovaries, of course, senesce, they fully retire. The male gonad, of course, quiets down and starts becoming diminutive. And then, of course, the stress and the age of time and our telomere length and all of these aging factors. And also inflammation becomes a big issue, aging. But so when we have metabolic dysfunction, we have to crawl ourselves out of the proverbial hole. And Fortetropin is one of those tools. And when you start building, like you said, the Evans say 18% increase in protein synthesis and older individuals, that's exactly what they need. They need to build the muscle. The muscle, of course, helps them become more active. And a more active moss does not grow on a rolling stone, or a body in motion stays in motion. So it's giving a person that ability. And also with surgeries or sports injuries. For example, I had a 55-year-old gentleman. He played soccer and still does to a degree with his 5 boys, but he had a terrible knee injury because he's trying to keep up with the youngsters. And I put him on Fortetropin before his surgery and after his surgery. So I also use it for people that, because there's that deutilization syndrome, and that deutilization syndrome becomes really issue. So we're cruising along our life, and then we are hospitalized. We have a procedure, and we're benched for 6 weeks as we're recovering. Well, the Fortetropin is also the tool there too for the clinician out there. It's like, okay, great, I'm going to put them on Fortetropin before the procedure, after procedure, so that they have that building block. Because that otherwise, in a dog study, they actually showed that the equivalent of a knee replacement, that if they were on Fortetropin, they did not have the muscle wasting. Whereas if they were not on Fortetropin, they were not moving around. So guess what? Atrophy. Just like if my arm was in a sling for 3 to 4 weeks, it's going to atrophy. So we want to help the body and something natural. And food is your best medicine. Fortetropin is a food.
Yes, and I love that you brought up inflammation. So can we talk a little bit more about that? How does inflammation tie both to cholesterol metabolism and muscle degradation? And how might interventions like Fortetropin fit into that conversation? And are there other interventions that you would also recommend?
Yeah, so beyond just C-reactive protein or the SED rate, we're looking at other inflammatory cytokines. And those cytokines poison the metabolic pathways, increase the chance for diabetes, increase the risk for cancers and other morbidities and mortalities that will shorten a person's life. So once again, the exercises are going to help with that. As to whether the study showing Fortetropin is going to actually have this magical effect on all inflammatory markers, no. But a lean, healthy body is able to bob and weave a little bit more down the field. And that's really what we're trying to get them to do.
Yes. So anything else that you want to mention about today's topic, Dr. Meletis, that we didn't cover, or any final takeaway as we end today's session?
I think back to endogenous. Our body makes CoQ10. Our body makes vitamin D. Our body makes certain things. And so as a result, we want to support those natural processes. Our body has a tendency with obesity and stress and aging and injury to increase our myostatin. We're trying to lower that. And so we're just trying to keep the body in harmony. We know the word homeostasis. Other people can say yin, yang, or teeter-totter. And so we basically want to level the playing field. And aging's happening, inflammation's happening. And what we need to do is have those tools. And I can tell you, before I learned about MYOS MD, I was unaware of the benefits of Fortetropin. Now, dozens of my patients are benefiting from it, and I'm seeing the clinical results. And so as a result, wow. I mean, I feel like, what didn't I know 20 years ago? What did I know 10 years ago? What did I not know a year ago? I didn't know about Fortetropin. Now we know about it. And what's beautiful, it plugs into every single protocol a patient, a doctor or provider has. It's like, what? Great, simple. Just plug it in, and it's just a scoop of the Fortetropin 1 to 3 times a day, depending on how aggressive we're being on the dosing. And we get the results. And in that one say, with the Evans say, 21 days. And we start seeing some benefit. Now you work out, you get your body in motion and you start seeing those benefits. It's also very popular amongst athletes to get that extra little edge as well. So whether you're a gym rat or not, or a weekend warrior, it has an application. But for aging, I think it levels the playing field. And my wife is a vegetarian, strict vegetarian, and but not a vegan. So I've incorporated the Fortetropin there because I'm getting older. Guess what? The wife of 35 years is getting older, a wonderful, wonderful human being. But I've noticed her muscle mass is diminishing. She's just not getting the protein and that anabolic benefits. So she's incorporated the egg product as well. And often in the Fortetropin, and often it can be mixed with yogurt. She's decided chocolate pudding. But she's getting it, so I'm not going to complain.
Yeah, that's great. I've recommended the same thing. My parents have been vegetarian their whole lives, and I can definitely see that this is something that has been improving their quality of life too. Yeah. All right, amazing. So thank you so much to Dr. Meletis for being our guest today. And thank you again to MYOS MD for sponsoring today's Power Panel. Fueled by the revolutionary proprietary ingredient Fortetropin, MYOS MD is trusted by healthcare providers nationwide, like Dr. Meletis, to deliver real results backed by science. So if you'd like to learn more about MYOS MD or Fortetropin, we have tons of other recordings on our YouTube, as well as on our website and on our blog. So please do not hesitate to check those out. And if you'd like to learn more about bringing MYOS MD to your practice, you can reach out to someone on the team. Alrighty, well, thank you so much. And yeah, if you have any other questions for myself or for Dr. Meletis, you can reach out to us via LinkedIn or through the MYOS MD team. Alrighty, well, until next time, thank you again. Bye-bye.